Today I will be talking about calcium in geriatric patients. First, what is calcium? Calcium is the fifth most abundant mineral in the body, and over 99% of it is stored in bone tissue. Although only 1% of the calcium is found in the blood and soft tissues, it performs the most critical functions. Calcium plays a role in different functions in the body, such as building and strengthening bones and teeth. That's why bone health depends on dietary calcium intake for bone structures. Muscle contraction, nerve impulse transmission, wound healing, cellular metabolism. Maintaining calcium levels. Because calcium performs such vital functions in the body, blood calcium levels is closely regulated by three hormones: parathyroid hormone, calcitriols, and calcitonin. The right side of the figure shows low calcium levels. The parathyroid hormone is secreted to increase blood calcium levels by three different mechanisms. When blood calcium levels are low, first, parathyroid hormone stimulates the release of calcium stored in the bone. Second, parathyroid hormone acts on kidney cells to increase calcium reabsorption and decrease excretion in the urine. Third, parathyroid hormone stimulates enzymes in the kidney that activate vitamin D2 calcitriols. Calcitriols is the active hormone that acts on intestinal cells and increases dietary calcium absorption. When blood calcium levels become too high, as shown on the left side of the figure, the hormone calcitonin is secreted by specific cells in the thyroid gland, and parathyroid hormone secretion stops. At higher non-physiological concentrations, calcitonin lowers blood calcium levels by increasing calcium excretion in the urine, preventing further absorption of calcium in the gut, and directly inhibiting bone resorption. Calcium effect on aging. As people age, calcium bioavailability is reduced. The kidneys lose their capacity to convert vitamin D to its most active form. The kidneys are no longer efficient in retaining calcium. The skin is less effective at synthesizing vitamin D. There are changes in overall dietary patterns, and older people tend to get less exposure to sunlight. Therefore, the risk of calcium inadequacy is more. Most older people develop osteoporosis with age. Osteoporosis results in bone loss and increased risk of fractures that can lead to death. Bone is an energetic tissue that is consistently broken down and remodeled by osteoblast and osteoclast activities. Going to calcium digestion. The acid secreted from the stomach converts the calcium to a salt, which is absorbed primarily in the duodenum. Unabsorbed calcium is precipitated in the ileum and is excreted in the feces. Lactose, the sugar of milk, aids calcium absorption, whereas excess fatty acid and high concentration of magnesium and oxalates interfere with it. Calcium absorption. Although it is an essential mineral, it is poorly absorbed. Not only the high amount of calcium, but also calcium absorption is necessary. Some factors that influence calcium absorption positively were reported, including an acidic condition in the intestine, probiotics, and symbiotics. Going to the calcium absorption pathways. There are two transport processes are responsible for calcium absorption. First, which is the transcellular transport. It is the primary type of calcium absorption. It absorbs about 60% of ingested calcium. Epithelial calcium channel, TRPV6. It is essential for calcium entry across the plasma membrane. as the first step in the transcellular pathway of calcium transport. Calbindin D9K facilitates the vitamin D dependent movement of calcium through the cytosolic compartment of the intestinal cells. It is stimulated by calcitriols vitamin D. It requires the active form of vitamin D, 125 dihydroxyvitamin D, and it is stimulated by low calcium diet. The second type, which is the paracellular transport. The paracellular calcium absorption is a passive process, not saturable. It most likely occurs in the jejunum and ileum, requiring no carriers. Occurs when high calcium in the lumen, when the gradient of calcium between the lumen and basolateral side. Paracellular transport occurs between cells to allow calcium diffusion. Calcium absorption. Once inside the cell, calcium is transported to the basolateral membrane bound to the buffer protein, calbindin D9K, which has a high affinity for calcium. Calmodulin, an important calcium binding protein, contains a large amount of glutamate and aspartic acid in the calcium binding domain. It may contribute to the intracellular translocation of calcium, but to a lesser extent than calbindin D9K. Calcium is extruded from the epithelial cells to the interstitial space by the action of the calcium pumping ATPase and a sodium calcium exchanger located in the basolateral membrane. TRPV6 and calbindin decline with age, which is the reason for higher calcium intake for older people. The intracellular mobilization of calcium. It is classified as first messenger, secondary messenger, and response. The first messenger, which is the ligand. After activation, it goes to the activation to the second messenger, leading to the activation of the intracellular molecule, which is IP3, DAG, and calcium. The process goes as ligand bind to the G protein coupled receptor. Now the G protein coupled receptors becomes activated, activating phospholipase C. Phospholipase C act on PIP2, phosphatidyl inositol 4,5 biphosphate, giving IP3 inositol triphosphate and DAG, diacyl glycerol, a channel located on the endoplasmic reticulum, IP3 calcium channel. Since the endoplasmic reticulum is saturated with high calcium levels, the free IP3 binds to the IP3 calcium channel, allowing calcium to go down a concentration gradient to the cytosol. Now the cytosol have high concentration of calcium. DAG and calcium lead to the activation of protein kinase C, which will lead to the phosphorylation of proteins. Osteoporosis. Osteoporosis is an imbalance between activities of osteoblast and osteoclast. Osteoblast plays an essential role in maintenance and regeneration of bone mass, determining bone quality and functioning of the skeletal system. Osteoclast produces a variety of enzymes that dissolves the bone matrix and calcium of bone. Osteoporosis is a metabolic bone disease that results from the osteoclastic bone resorption, not compensated by osteoblastic bone formation. Going to the risk factors of osteoporosis. The risk factors of osteoporosis can be divided into unmodifiable and modifiable factors. Unmodifiable factors such as genes, gender, and age. Modifiable factors include smoking, being overweight, food choices, and physical activity. Where oxidative stress, related factors are included in modifiable factors. Oxidative stress is an imbalance between free radical production and antioxidant capacity. It is one of the factors which accelerate osteoporosis. Antioxidants, either directly or by counteracting the action of oxidants, contribute to activating osteoblasts and reducing osteoclast activity. A marked decrease in the plasma antioxidants was found in aged and patients with osteoporosis. Chicken eggshell. A case study showed that chicken eggshell powder could be an excellent method to increase calcium intake. The eggshell contains 95% calcium carbonate and other valuable components such as strontium and boron, which plays a vital role in osteoporosis prevention. The application of chicken egg as a source of calcium in various food products have a significant benefit in terms of nutritional values, depending on the type and pH of food product. It can be added to bread, biscuits, dairy products such as yogurt, fried cheese, or cranberry juice. A study suggested protein-enriched foods for old people. Increased protein intake has been associated with beneficial health effects for older people, including increased lean body mass and strength and lowering risk of becoming frail. Vitamin D and calcium-enriched functional foods are recommended to promote bone health and prevent osteoporosis in older people. Osteoporosis is a prevalent disease that affects up to 50% of the US population over age 50. A few simple diet changes so that the patient can improve the bone health and reduce the symptoms of osteoporosis. The DRI, the dietary reference intake for calcium, is based on evidence related to bone health, mainly from the results of calcium balance. The dose-response relationship between nutrients intake and the bone health is examined. The dietary reference values for adequacy are specified. Dietary reference intake in geriatric. DRI for calcium for men 51 to 70 years of age takes 1000 mg per day. 71 years of age and older takes 1200 mg per day. DRI for calcium for women 51 years of age or older takes 1200 mg per day. The upper level for calcium 51 years of age and older takes 2000 mg per day. Calcium supplementation is required for all of the following: geriatric patients, patients following a vegan diet, having a lactose intolerance or limit dairy products, consume large amount of proteins or sodium, receiving long-term treatment with corticosteroids, or having a certain bowel or digestive disease. Best diet and food for osteoporosis. Dairy products. Significant amount of calcium contains vitamin D, another component of bone health. Fruits and vegetables. Some vegetables, such as leafy greens like kale, broccoli, and okra, can provide even more calcium. These vegetables and others, like potatoes and artichokes, may also provide magnesium and vitamin K. Fish. Different fish can provide calcium and vitamin D, or both, such as canned sardines with bones, salmon, mackerels, and tuna. Fortified food. Several foods have added calcium and vitamin D to help reach daily needs. Many breakfast foods, such as juices and cereals, tend to have added fortifications. Breads and other wheat products may provide higher than usual calcium and vitamin D levels. Osteoporosis nutrition therapy. Other minerals can be added to calcium and vitamin D that benefit bone health. Magnesium maintains parathyroid hormones levels and acts as a buffer against acidosis. Copper helps in cross-linking of collagen, removes free radicals. Vitamin K maintains an alkaline environment that reduces the need for bone calcium to regulate pH. Vitamin B increases stability and half-life of vitamin D, and estrogen prevents bone demineralization. Vitamin C can improve bone health because of its antioxidant property. Other foods that can decrease calcium absorption as fibers, oxalates, oxalates found in spinach and berries, while phytates found in whole grains and legumes. As a conclusion, the geriatric population is increasing globally. The quality of life of older people should have functional food to reduce the risk of osteoporosis. Ensuring that foods with bone protecting properties are eaten throughout the life cycle may help to reduce susceptibility to fractures. Calcium and vitamin D intake and their co administration reduces fracture risk in the target for geriatric patients. Thank you.